September is Sepsis Awareness Month, a time to raise awareness about the serious and possibly life-threatening condition. This morning on Ask a Specialist, we'll talk about what you need to know with Dr. Jatinder Lachar, internal medicine hospitalist at the Queens Medical Center. Thank you so much for joining us, Dr. Lachar. First of all, tell us, what is sepsis?
Thank you for having me. Sepsis is a serious illness when infection travels throughout the body, which can be life-threatening. Now, sepsis can be infection in any part of your body. Some of the common associated infections with sepsis are the lungs, which can be pneumonia, the kidney, a urinary tract infection, infection of the skin, or infection of the bowel or intestines.
So if, I was having an infection, what are the primary symptoms that I would alarm me, and where I should seek medical help?
So sepsis, again, can be infection anywhere. So there's not one symptom that's always associated with sepsis, but some of the common symptoms that you can see would include a fever, a low body temperature at times. Someone may not have a fever always, sweats and chills, cool, clammy skin, trouble breathing or breathing at a fast respiratory rate or breathing fast, fast heart rate, and even confusion and dizziness and lightheadedness can occur. So just to be clear, you don't need to have all these symptoms. You may only have one, or you may have many of these symptoms.
So how would you prevent sepsis, and then how would you treat it?
So number one for preventing sepsis is avoiding infections. Now, how do we do that? Being up to date on your vaccines, regularly washing your hands, avoiding someone if they're sick, and also if you have an infection, getting treated quickly by your medical provider. Now, going back to that, if someone does have an infection and you can't see your doctor immediately, and you can't get a follow-up with them or speak to them, you do need to go to the nearest emergency department or emergency room to get treatment. Now, within the hospital, we do have standardized treatment for sepsis. This is known as a sepsis bundle. What this means is initially there'll be specialized blood tests such as blood cultures, lactic acid blood tests, and others, and then IV antibiotics. So that means antibiotics through IV into your vein, and IV fluids for particular patients. And finally, some patients may even need a medication called IV vasopressors when their blood pressure did not respond and it was too low to the IV fluid, so it needs to be increased with the IV vasopressors.
So say you have an infection, is there one primary symptom that you would tell me go and seek emergency help right now?
I think with sepsis can be many symptoms. So I think one that would be concerning is a fever. If you have a fever, you should get advice from your doctor or go to the nearest emergency room if needed.
To learn more about the services provided by the Queens Health Systems, including a list of doctors and their specialties, just visit queens.org. Thanks so much for joining us, and thank you, Dr. Lachar.
You're welcome. Thank you for having me again.